Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey. It's Medical Monday, and today we're sitting down with a new member of the East Cooper Medical Center team to see what this board-certified, fellowship-trained urologist can do to help patients right here in the Lowcountry.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Stephanie Seixas-Mikelus here with us. She's a urologist here at East Cooper Medical Center. Thanks for being here.
Thank you for having me.
All right, so today we're talking about urology. We just want to get the facts. First off, what is urology?
Urology is a field of medicine that specializes on the medical and surgical diseases of the male and female urinary tract system.
Because a lot of people think it's just male, right?
Well, it does include the male reproductive system.
Like the prostate?
Yes, that's correct. However, there is a misconception that we treat only men, but we do indeed treat both men and women.
Okay, so what are the common things you're treating?
So we treat both malignant and benign disease. Some of the more common disorders include kidney stones, an elevated PSA, benign prostatic enlargement, hematuria, what we call blood in the urine, recurrent bladder infections, urinary incontinence, sexual dysfunction, and cancers of the urinary tract system. So we're talking kidney cancer, bladder cancer, prostate cancer, testicular and penile cancers.
So you're really passionate about the oncology part of it, right?
Yeah, that's correct.
What caused you to get into that specific area?
You know, I always was attracted to that subspecialty, really being able to have that long-term relationship with patients from the time that they're diagnosed and then potentially curing them of the cancer and taking care of them for many years thereafter.
So I know a lot of people, going back to what you were talking about with kidney stones. I've had a ton of friends with that. What are the causes of that?
So that's a great question. There are many driving factors for a higher rate of kidney stones or developing kidney stones. Typically, the risk factors include dehydration. Okay, so you're just not drinking enough water. And then there's dietary and genetic factors as well.
Okay, so I know I have a friend who drinks a lot of lemon. Is that a normal thing?
Yeah, that's correct. So actually what we recommend for all patients to try to prevent stones is to drink plenty of water. So you're talking at least 2 liters, ideally 3 liters of water a day. Eat a low animal protein diet, have low salt intake, have and maintain a good calcium intake through natural food sources. And where that stems from the lemonade is because we encourage patients to increase citrus fruit intake, and that's because there's an element in citrus fruits that actually is thought to inhibit stone formation.
Oh, wow. And do you see kidney stones a lot?
Oh, we do. So, you know, for those of us living here in Charleston, South Carolina, I mean, we are living in America's Stone Belt. And it's just, unfortunately, it's the association with the increased temperature.
The temperature, and not just the fact that we love, you know, eggs, bacon, all the fatty foods and stuff.
It's multifactorial.
Okay. All right, so as far as urology as a whole, what are some of the things that, you know, general health-wise, that you can give people some advice on ways that, I mean, you don't want them to have to come to see you, right? So what are some of the ways they can maintain a healthy, you know, what is it, urinary tract for women, and then or is it both?
Sure, well, for both. And you know, and you know, I think the key element is just drink plenty of water. Hydrate those kidneys.
Okay.
And of course, you know, in terms of prevention for bladder infections for ladies, we always encourage drinking cranberry juice or taking the cranberry supplements, and then having a probiotic, whether it's the supplement tabs or having a yogurt a day that has acidophilus in it.
Because I told you before when we were off camera, there is nothing worse than a urinary tract. Is that the same as a bladder infection?
That's correct. I mean, you can have an infection anywhere in the urinary tract system, but the most common, yes, is in the bladder.
And those will cripple you for days, right? If you don't get them caught.
It's very miserable.
All right, well, thank you so much for joining us today.
Thank you for having me.
And for more information, of course, you can always head online to eastcoopermedctr.com.